After the age of 50, knee pain becomes increasingly common, affecting daily movement and overall quality of life.
Knee joint is supported by cartilage, ligaments, and surrounding muscles that work together to allow smooth movement. Cartilage gradually wears down, leading to osteoarthritis, the most common cause of knee pain after 50.
Excess body weight increases pressure on the knees, accelerating joint damage over time.
Morning stiffness, mild swelling, and discomfort during movement are early warning signs.
Regular strengthening exercises and physical therapy can significantly reduce pain and improve joint stability.
With proper care, healthy habits, and early treatment, knee pain after 50 can be effectively managed. Weak thigh muscles reduce the natural support around the knee, increasing strain on the joint.
A sedentary lifestyle contributes to stiffness and accelerates joint degeneration.
D and calcium deficiencies can gradually weaken bones and worsen joint pain. When cartilage wears down, inflammation develops, causing swelling and persistent discomfort.
Pain often increases during walking, climbing stairs, or extended physical activity.
Diagnosis allows treatment to begin before significant joint damage occurs. Maintaining a healthy body weight significantly reduces stress on the knees. Strengthening exercises improve stability and protect the joint. Regular low-impact walking keeps the joint mobile and nourished.
Daily stretching improves flexibility and reduces stiffness.
Heat therapy relaxes muscles and can temporarily ease stiffness.
In some cases, medications or joint injections may be recommended.
For severe joint damage, knee replacement surgery may restore mobility and quality of life.
In some individuals, autoimmune conditions like rheumatoid arthritis may also contribute to chronic knee pain. Genetic factors can increase the likelihood of developing joint degeneration later in life.
Morning stiffness lasting several minutes is often one of the earliest warning signs.
Visible swelling around the joint may indicate internal inflammation.
Some patients report a grinding sensation during movement.
Over time, the range of motion may become restricted.
Pain typically increases during physical activity and improves with rest.
Consulting a medical professional ensures an accurate diagnosis and personalized treatment plan.
Simple lifestyle adjustments can significantly slow joint deterioration.
Strengthening the quadriceps muscles provides critical support to the knee joint.
Low-impact activities such as swimming reduce stress while maintaining mobility.
Regular stretching improves flexibility and reduces stiffness. Footwear can improve alignment and reduce joint strain. Heat relaxes stiffness, while cold therapy may reduce inflammation. Anti-inflammatory medications may be prescribed when necessary.
Knee braces offer additional stability during daily activities.
In certain cases, joint injections can provide temporary relief.
For advanced joint damage, knee replacement surgery may restore function.
With consistent care, many individuals maintain an active lifestyle well into their later years.
Knee pain after 50 is common, but with informed action and proper care, it can be effectively managed.